guys, welcome to Nurses Handbook, and today I'm here with some quick revision points or notes to help you out in the preparation for your nursing competitive exams. The first quick point to remember is that whenever a client's ECG shows ST elevation in leads V2, V3 and V4, it suggests an anterior wall MI, myocardial infarction. Second point is multiple myeloma is characterized by malignant plasma cells which produces an increased amount of immunoglobulin which is not functional. Third point is Braxton Hicks contractions are painless contractions that occur throughout the pregnancy. So now let us see some of the features of Braxton Hicks. So first is these contractions feels like tightening or very mild cramping, and there will be no regular pattern for it. It goes away with rest, hydration, position changes, and with time it gets reduced. And it does not feel stronger over the time as true labor feels stronger and painful over the time. And it is localized in the abdomen and in the groin region. Next point is Chadwicks sign or probable sign of pregnancy, which refers to the color of the vaginal walls which change from normal light pink to deep violet. Coming to the next point, that is muconium in a breech presentation may be caused by compression of the fetus on the intestinal tract during the descent. So next is, when do we call a non-stress test to be reactive? It is said to be reactive if 2 or more fetal heart rate accelerations that exceed the baseline by at least 15 beats per minute, which lasts longer than 15 seconds within a 20-minute period, we consider that non-stress test to be reactive. Next point is, an infant hold onto furniture while walking at 10 months, walks with support at 11 months and takes his first step without support at 12 months. At 8 to 11 months, birth weight triples and birth length increases about 50%. The next quick point is, when the heart stretches beyond efficiency, an extra heart sound or SREE gallop may be audible, can be heard. Next is, for an infant in heart failure, formulas with increased caloric content are given to meet the greater caloric requirements from the overworked heart and labored breathing. Moving to the next point, that is electroconvulsive therapy is most commonly used to treat major depression in the clients who have not responded well to antidepressants, and it is also given in patients who have medical problems that contraindicate the use of antidepressants. Next point is, for maniac clients, it is best to ask closed questions because open-ended questions may enable the client to talk endlessly, thus contributing to the client feeling out of control. The next point is, cognitive disorders result from any condition that alters or destroys brain tissue and in return impairs the cerebral functioning. Next point is, in dissociative fuse, the client may travel from home or work and become suddenly confused about his personal identity, and the client may take on a new identity and can't recall the past. Next quick point is, a drug interaction occurs when a drug given with or shortly after another drug increases or decreases the effect of either or both the drugs. Next is, immunosuppression is an adverse effect of the repeated use of steroid, which is a medication commonly used to treat myasthenia gravis. Propranolol and other beta adrenergic blockers are contraindicated in clients with bronchial asthma. Injection magnesium sulfate should not be administered in normal saline solution as it forms precipitates. So it is preferred to be given with 5% dextrose only. The point is, providing counseling and support for families who have lost their homes is an example of tertiary prevention. Now we will be seeing about the autocratic management style or the leadership style. In this, decisions are made with little or no staff input. The leader gives orders and makes decisions for the group. This style dampens the creativity and lacks motivation in the group. Autocratic management or leadership style is also called directive, controlling or authoritarian style. Moving to the next point, that is about the democratic management or leadership style. It is also known as participative management or style. In this, staff members are encouraged to participate in the decision-making process whenever possible, and most decisions are made by the group, not by the manager. Coming to the next point, that is about the laissez-faire leadership, which is also known as permissive or non-directive leadership style or management style. In this, very little direction or planning or support is provided by the manager. The manager abdicates or runs off from the responsibility and decision making whenever possible, and in this type of style, staff development is not facilitated. Now coming to the last quick point, that is, in case fire occurs in the hospital, one must act quickly and use the memory aid RACE, R-A-C-E. So now let us see what this RACE acronym stands for. First is R, which means rescue. So try to rescue as many as people possible. Next is alarm. A for alarm, that is to alert others and seek help by telling the location of fire where you are standing. Third is C, which means contain or confine the fire by closing the doors and windows to cut off the air supply. The last one is the E, that is extinguish, that is to put off fire with the extinguisher present there or with water if possible. Thank you for watching. For more videos and updates like this, do like, share and subscribe to our channel Nurses Handbook. For any doubts and queries, please post it in the comment box.